So eye medication can come in lots of forms. This one here is in a drop form, but you may also be prescribed an ointment to administer, which comes in a small tube. The drops are designed so that as you open up, they will just literally, by pressing on that bottle, they will administer just one drop. And that's all you will be asked to administer at any one time to the eye, just one drop at a time. If you're given an ointment, then the amount to administer is just the size of a grain of rice, just to give you a frame of reference there. So what we need to do here again is we're going to hold his head very gently by holding that muzzle, which will just stop his moving his head around like so. And as we come to do it, what you need to do is you're just going to pull that upper eyelid up just very slightly while holding that head back. And by doing that, you're just exposing as much of the eye as possible, and then you can drop the eye drop onto that eye. If you come in from behind the eye as opposed to approaching your pet face on, it's far easier to do. So I would always approach from the behind there, just drop it there and drop that eye medication onto the eye. So we'll give that a go now. Good boy, Milo. Good boy. So you can see we're just gently elevating his head, pulling that top eyelid back with my lower finger. And he was an excellent patient there, weren't you? Now, if you have a number of eye medications to administer, you do need to leave at least 5 minutes between each eye medication, quite simply because the eye only has a certain amount of drug which it can hold at any point, so that needs to be absorbed first before administering any more drops. You also need to think about the order in which you administer those drops. So you need to administer drops with increasing viscosity. So that basically means you're going to administer the liquid runny drops first and then proceed on to the more thick drops, the ointments, towards the end.